Hi, my name is Kathleen, and I'm going to be talking on behalf of my team regarding our systematic review looking at the efficacy, feasibility, and acceptability of using video conferencing as a treatment modality for couples and family therapy. Our search returned 7,112 abstracts, with 37 papers included, looking at 28 studies. Efficacy was defined by significant improvement on mental health measures, with feasibility measured in terms of practicality and the ease of implementation, adaptation, demand, risk, and recruitment, and acceptability determined by patient satisfaction, working alliance, and dropout rate. 16 of the 28 studies applied video conferencing with children and parents, 7 with adolescents and parents, and 5 with adult couples and family members. The most common presenting problem was moderate to severe traumatic brain injury, representing approximately 52% of the studies. In terms of efficacy, all of the studies report a significant improvement in at least one mental health outcome. 3 papers compared their online intervention with face-to-face and found no difference. However, 1 paper did find a difference, noticing a greater symptom reduction in the online group. In terms of feasibility, adaptations were made to these interventions were generally not unique to couples and families. However, some adaptations were made according to the specific interventions, for example, in parent-child interaction therapy, where the use of portable headsets was implemented. 1 study conducted a needs assessment. Other studies based their rationale for online delivery on the need to overcome geographical barriers, stigma, and promote access to professionals. 2 studies reported there were no adverse events. 7 studies listed active risk as an exclusion criteria, and this was not addressed further. In terms of acceptability, 25% of included studies reported working alliance, noting high levels across these and no difference between in-person and online. And 60% of the studies addressed treatment satisfaction, with a similar pattern of results found. Finally, 36% of studies reported 0 client dropout, and when dropout did occur, these rates were low. In terms of research, we offer 3 key recommendations. The need for additional research regarding systemic family interventions with a focus on couple and marital problems. Secondly, additional research with adolescents may be worthwhile. And thirdly, increased use of in-person comparison groups in future RCTs. In these studies, risk issues must also be explored, as there's little evidence in this area. Of the 3 clinical recommendations we offer, the first is recognising the importance of training clients with the use of the software and the hardware. Secondly, it is recommended that there is an early discussion around boundaries to proactively minimise disruptions from other family members. And finally, we recommend thorough training and familiarity with ethical guidelines for clinicians in regards to handling risk issues. Based on this summary, we're able to conclude that videoconferencing psychotherapy as a treatment modality for families and couples is efficacious, acceptable, and feasible. Thank you.